Hello everyone, today I will discuss with you cellular adaptation. In previous video I completed this topic, reversible cell injury. So now we all know that cellular responses to stress can be of three types. Reversible cell injury, which is temporary loss of cellular function, irreversible cell injury, which is permanent loss of cellular function, and cellular adaptation. In case of adaptations, the cells try to make an adjustment with the new environment and it is expressed as morphologically. First, see the definition of cellular adaptation. So, physiological stress and some pathological stimuli can induce a number of cellular differentiation and growth disorders. This is called cellular adaptation. Here, physiological stress and some pathological stimuli are the etiologic agents. So, when the cells are stimulated by these etiologic agents, then the cells are giving response to that particular stress by increasing in number, which is called hyperplasia, by decreasing in size, which is called atrophy, by increasing in size, which is called hypertrophy. In case of metaplasia, one type of cell is converted to another type of cell, and dysplasia is the abnormal development of cell. In this video I will only explain hyperplasia, remaining I will discuss in upcoming videos. Hyperplasia is an increase in the number of parenchymal cells resulting in enlargement of the organ or tissue. Normally, if the number of cells are increased, then the related organ or tissue size will also be increased. Now, our all kind of body cells does not have the capacity of hyperplastic growth. So, it is mainly seen in labile cells and stable cells. Labile cells are those cells which have short period of lifetime and which are multiplying continuously throughout their life. For example, epithelial cells of skin. Then stable cells are kind of cells which multiply only when needed. For example, parenchymal cells of liver. Unlike labile cells and stable cells, permanent cells, for example cardiac muscle, skeletal muscle, have no capacity or very low capacity of hyperplastic growth. Causes of hyperplasia. Hyperplasia can occur due to physiologic condition and pathologic condition. Physiologic condition is related to normal functioning of your body and pathologic condition is abnormal functioning of your body. Depending on this, hyperplasia can be physiologic or it can be pathologic. Most common types of physiologic hyperplasia are hormonal hyperplasia and compensatory hyperplasia. Some examples of hormonal hyperplasia like enlargement of uterus during pregnancy, hyperplasia of female breast during puberty, during pregnancy and lactation, then proliferative activity of normal endometrium during normal menstrual cycle. This means that during the onset of menstruation, the endometrial layer of the uterus is degenerated and shed. After that, in the proliferative phase, the endometrial layer of the uterus is again regenerated. Then compensatory hyperplasia occur because of removal of part of an organ. For example, regeneration of liver following partial hepectomy. So, for any disease condition if some part of liver is resected, the mitotic activity of the remaining part of liver will begin within 12 hours of the surgery. Then pathologic hyperplasia. One example of pathologic hyperplasia is prostatic hyperplasia. So, this is the gross structure of male genitalia and this is the normal structure of prostate. In case of prostatic hyperplasia, the size of prostate gland will be increased. For example, benign prostatic hyperplasia. So, it may occur in people over 60 years of age due to stimulation of dihydrotestosterone, which is a metabolite of testosterone hormone. Another example of pathologic hyperplasia is endometrial hyperplasia. So, in physiologic hyperplasia, the endometrial layer of the uterus is regenerated during each menstrual cycle. But in case of pathologic hyperplasia, due to prolonged and increased level of estrogen, the endometrial layer are enlarged. So, it may occur because of tumors of ovary which secrete the hormone estrogen. So, this is the gross structure of female genitalia and this is normal endometrium. But when estrogen level is excess, then the endometrium layer is enlarged. Okay. Now you just remember one thing, that hyperplasia differs from neoplasia, because as soon as the stimulation is decreased, the cell can the cell may revert back to its normal state from hyperplastic growth. But in case of neoplasia, the growth of cell is uncontrolled and it may lead to malignant tumors. So by this we complete the topic hyperplasia.